Hi everyone, I'm Dr. Karam, board certified facial plastic surgeon, founder and creator of KaramMD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today I'm going to treat you to a very, very fun compilation of 3 patient journeys. And I want you to sit back, relax, enjoy, and watch as our 3 patients go through beautiful facial rejuvenation transformations. And we're gonna take you through the assessment, through their recovery, through how they feel about things, and ultimately their beautiful before and afters at the end of it. All right, folks, so stay tuned. Watch all 3 of these gorgeous before and afters and their journeys. You are going to love it. All right, without further ado, let's take a look at journey number 1. So I'm with Brandi. So let's go over the things we're gonna do. First of all, how old are you?
I am 49.
49, it's like the perfect age because you're just starting to notice the changes happening.
Yes.
How long have you been bothered by them?
I would say the last about 5 years I've noticed it. I've used fillers and different things, but it just isn't lasting as long. And so I've been a little bit self-conscious of it.
This is the morning, the big morning right before surgery. So let's go ahead and mark the eyelids here.
Just so you can see, that's kind of where the scarring looks like at the 2-week mark. Everything else has healed up so nicely. I still have some green under eye bruising. You can see here, that's how that side is healing up. That's how this side is healing up. My lip lift is coming together very nicely right there. You can see the incision. And that just seems to get better by the day as well. I have less swelling today. At the 4-week mark, I also have less bruising. I notice that's all really coming together really nicely. So that's really a plus. I can leave the house really without any kind of makeup on, just some sunscreen, and not look too beat up looking anymore. Right now, all I have on is Dr. Karam's Trifecta, which is his skincare line. And I also have on a sunscreen chapstick. I have lash extensions on and a tinted sunscreen because I always have to put sunscreen on. I didn't do it at all in my younger years, which is a big mistake. But now, especially even after surgery, you really want to put sunscreen on your incisions and keep those protected so they heal up even nicer. So those are the things I never leave the house, but the Illuminate from the Trifecta really gives you this beautiful glow. I love it. I'm super happy. My favorite part is that I have my jawline back. The excess skin that was here and driving me crazy in my jowl area, don't have to worry about that anymore. It's been 5 weeks since I had my vertical restore with Dr. Karam. You can kind of see my profile on both sides. As I've had a few people talk about my lips not being symmetrical, and that was prior to surgery. I have a scar line here, a diagonal vertical scar right here that was from a dog attack when I was a child, and so my lips have never been symmetrical. That's how they've always been. It has nothing to do with surgery. That's just how my lips are. So this week marks my 6-week mark of post-op vertical restore surgery that I had with Dr. Karam. My lip lift has only sunscreen on it, but you can really tell it's healing up very, very nicely as well. I've had a few people ask about behind my ears and what that looks like. To kind of get back here so you can see, it's kind of what it looks like back behind the ear. You really can't tell from behind that I've had anything done whatsoever. I'm loving the way the fat transfer has started to settle in. I was puffy for the first little while, so it took some time, but now I can really see that really nicely contoured cheekbone right there. It's been a pretty easy process. I've stayed very positive throughout the whole process, which has really helped. You just kind of have to trust the process and not freak out about things. 6 weeks in, we're looking pretty good. Like I said, I can always kind of cover this up if I want to go out with even my short hair, throw a little concealer on there, so it is very coverable, even this part. But other than that, that is how I'm healing up at the 6-week mark.
So when you look at Carrie, you can see that there is a loss of volume under her eyes. You can see that the upper brow area has deflated, the temples have lost some fullness. You can see that the lips and the areas around her chin has lost some fullness. These is all from deep fat pads beginning to diminish as time goes on. Then you look at the sagging changes. You take it from the top and you see the lateral brow starts to sag. The mid face starts to sag. You start deepening of the nasolabial folds. You start to see the jowling present. And then you look at the neck and there's a heaviness and banding of the platysmal muscle as it starts to wear down and pull away from the upper face. Then you look at the central face and you see that there's extra skin in Carrie's upper eyelids, there's extra skin and fat in her lower eyelids, and then there's an overall elongation of her upper lip and a thinning of her red lip or her true upper lip.
This is end of day 1. I have soreness in my lip and on my eyes. Don't really feel the soreness on the side, and I have a little bit of soreness on my stomach where the suture is, where he harvested the fat. I did throw up this evening. I think I'm gonna feel a lot better tomorrow. Day 3, my eyes are really swollen today. I feel really tired and red. Day 4, I washed and curled my hair today. Feeling a little bit more normal. Waiting for the swelling to go down. This is day 6. Day 6 is much better than day 5. Day 5 was kind of rough, but I feel like the swelling has really gone down this morning. My neck just looks amazing. I'm really happy with my neck. Lips are still swollen. I just have a little bit of lip gloss on today, no makeup. It's day 7. I have a lovely shade of yellow under my eyes, which I'm sure will be easy to cover with makeup on day 10. I'm going to get my stitches, the rest of my stitches removed in about a half an hour, and I'm super happy with the results so far. Here's day 10. I feel like my eyes are finally evening out a little bit today. I've always had a problem with my left eye being a little bit smaller than my right eye. And Dr. Karam was very realistic with me before my surgery, and he said that sometimes if your eye socket might be just different, there's asymmetry in everybody's face, that the eyes won't change. But I feel like it is starting to look a little bit more even. Bruising is still improving. Incision is getting better. It's day 12. And I am heading off to work for the first day since I've had my surgery, and we'll see what my employees and my clients notice today. Should be interesting. Day 15, no makeup, no filter, just standing in front of the window. Bruising's almost gone. Okay, it's 1 month today that I had my procedure done with Dr. Karam. Swelling is still a little bit on my left side. Bruising is mainly gone. I just have a little bit of my sunblock on my face and some lip gloss and some eyebrow pencil. You can see the discoloration underneath my eyes is finally almost gone. My scars just get better, improve every day. It's a little over 3 months since I had my procedure, so I wanted to give you an update. I was starting to feel invisible at my age, noticing that I didn't look like myself anymore. And unfortunately, ageism is real in our culture, and I decided that I wanted to invest in myself. The comments and the reactions from my family and friends and colleagues has been 100% positive. I feel like my self-esteem and my confidence has improved, and I just wanted to thank you so much for helping me to look as young as I feel inside. Thank you, Dr. Karam. I hope that this video helps other women who are considering investing in themselves.
I'm going to show you one of our patients. Her name is Ellen. She's 68 years old. She had a vertical restore. She had her upper and lower eyelids done. She had a fat transfer done, and she had a full field laser resurfacing using the Contour TRL, which is an erbium YAG laser.
Hi from Facelift Central. We're on day 4 and I'm a hot mess, mostly from the laser. I must tell you, it looks like it should hurt. It does not hurt. It does hurt to look at it. So I have not been looking at myself starting yesterday, which is great. For about the past 10 years, I have been unhappy with my skin texture and also the wrinkling and sagging on the sides of my face. I tried to be okay with it. I really did. I thought, oh, you know, Ellen, you're being shallow. I really had a lot of self-shame about not liking how I looked. I don't expect to look like I'm 30. I just wanted to look like my best self at 68, basically, and feel that the outside sort of was similar to how I feel inside. I wish more people would share publicly, but you know, I'm trying to break that conversation open a little more. I hope it's helpful to everybody. Even if I help one other woman, I'm gonna be happy.
All right, so we are day 7 with Ellen. I just had a chance to look her over. Very little in the way of bruising, some discoloration that's normal and natural. Ellen, tell us a little bit about what the week was like for you.
Unbelievably easy. I am shocked. I have to say, first of all, I've been on Tylenol. I was on Tylenol for only 3 days, and then I really was great. And honestly, the Tylenol was more for the laser sunburn discomfort. And then that only lasted a few days, and then you're okay. And energy-wise, I have all my energy. One of the big questions I have, which I'm sure everyone else is wondering too, what's up with the lip? And I asked the same thing. I said, you know, it seems like this is super red. And anyhow, everybody reassured me this is the normal process, and not at all concerned about it. It's gonna be great, so that was good. I asked questions like, now they took out the stitches, am I able to wash the side of my face? Because there is so much goop on your face, which is really important to keep moisturizing, and it was also on the stitches. But today, I got to wash that goop off my hair. So that was exciting. And it's still not putting water all over my face, so that I did very carefully in the shower with a handheld shower head. The redness is calming every day. The bruising is going through its yellow stage, but it's getting less and less. Good morning, day 13 from Facelift Central. Every day there's new healing. The redness is getting better and better. and the swelling is coming down a little, so all part of the progress. Good morning, it's Sunday on day 19 at Facelift Central. Many of you wanted to see my incisions, so I'm going to try to do that. I put my hair up for you. The incisions start like right about here. They go down into the ear, also behind the ear, and a little bit into the hairline. Also, you wanted to see my side view, so there you go. My neck is amazing. You are numb. I mean, I'm numb from on the neck, and I'm numb like right about here. The rest of my face I can feel just fine, and I can move it just fine, no problem. I understand the numbness goes away at different times for different people, and it's fine with me. I'm okay with it. It's not like you're touching your face all day, so you don't even notice it. And other than that, I'm really excited every day with the changes.
So we are here for our next appointment. We're 4 weeks out.
My lip looks amazing now. I'm so glad I did the laser. It looks painful, but it really was like a bad sunburn. And I don't want women to be scared because it is so worth it. I'm so glad I did my eyes. I was nervous about that. I hope that my journey will help you understand the real process, and you'll have the confidence to do what you want in your heart. I'm 7 weeks yesterday of a vertical restore, upper and lower bluff, and fat transfer, and a TRL laser. And I'm pretty excited.
All right, folks, I hope you enjoyed that wonderful tour and beautiful journey of 3 of our beautiful patients as they went through their vertical restore and facial rejuvenations. We are so blessed to have patients sharing their stories with us and sharing this with everyone out there. Their goal is really to help you and enlighten you and put you in a position where you can make good choices for yourself and really ultimately know what you're getting yourself into. They've all enjoyed and learned so much from the patients before them, so they want to give back, and I could not be more appreciative and blessed to have patients motivated and willing to share these journeys. If you haven't already, make sure you hit subscribe so you're going to see more educational materials on skin and facial rejuvenation every week. If you enjoyed this, drop a like, share a comment, let me know what you think. Any questions you have, I'll be more than happy to try to answer them. All right, folks, it was my pleasure. Warmly, Dr. Karam.